Yes, I think this was with Gail Roboz and Hart McDonough, and Gail was talking about the really important, indeed transformative role that Venetoclax and Azacitidine plays in the management of patients unfit for intensive chemotherapy. She was talking about how one can try and reduce treatment-related toxicity by limiting certainly the first course of Venetoclax to 21 days, making subsequent cycles 14 days, early bone marrow assessment after 3 weeks. And then there was a discussion about whether there's room for a randomized study that is actually examining whether lower doses of Venetoclax, shorter duration, or even early treatment discontinuation might be deliverable. And then I was talking a little bit about the triplet data that's emerging with FLT3 inhibitors, Venetoclax and Azacitidine, phase 1-2 data, but very promising high CR rates. Talking about the data also using more immunotherapeutic approach like magrolimab, anti-CD47, and that's data from the MD Anderson, very promising CR rates of a triplet with Aza-Ven magro, well tolerated. And I then went on to discuss with colleagues the emerging notion in my mind that in fit adults, the data generated in older patients may inform our practice, particularly if we think of allogeneic transplant as a central curative effect. You have to think of what is it you need for a successful transplant. Well, the patient needs to be fit after their induction chemotherapy. Helps if they survive the induction chemotherapy, but they also need to be in CR, preferably as MRD negative CR. And it's very possible that these new triplets, or even actually Venazone itself, may, either in very high-risk patients, particularly high-risk patients, or particular molecular subgroups, deliver equivalent CR rates with much less toxicity, maybe even better CR rates, in which case you can see the whole paradigm of how we treat fit adult AML changing. And it's not chemotherapy or transplant, they're all part of an integrated, unified package. And I think that's the way we're increasingly going to see how we increase cure rates in fit adults with AML. Exciting time, new drugs, but also new ways of deploying transplant.